A group of anesthesiologists in Michigan are launching a new campaign that they say is aimed at informing patients of a concerning trend in healthcare.
News 8's Duncan McLean joining us live with a look at the claims that hospitals are using ER doctors to administer anesthesia during procedures.
Brian Sue, the group says that the goal of the campaign is to get patients to advocate for the very best care.
It's about transparency and truth for patients.
A group of anesthesiologists in Michigan say Corewell Health West is removing anesthesiologists from surgeries and replacing them with emergency medicine or ICU doctors. The Michigan Society of Anesthesiologists has launched a billboard and media campaign urging patients to ask questions about the medical professionals administering their anesthesia.
You as a patient, or you as an advocate for a patient or a family member, need to advocate for making sure you know who's delivering your care. Is your care being delivered by a board-certified anesthesiologist operating in a care team model with the CRNA? Or is it someone without those credentials? And patients need to be asking those questions. That's kind of what our message is today.
This comes after a contract between Corewell Health and West Michigan anesthesiologists was not renewed and ended on September 2nd.
I think from a hospital's perspective, the only short-term benefit might appear to be filling a staffing gap more quickly. But the reality is that patients are billed the same whether or not a physician anesthesiologist is involved.
WMA says contract discussions have stopped for now, but they are open to further negotiations.
There's been no reach out from Corewell Health to further talk and how to work together and take care of the community. So we're open always to serving the community. But as of now, there is no contract.
We reached out to Corewell Health to ask if they are, in fact, using emergency medicine doctors as anesthesiologists and if a new anesthesia team has been hired. They said tonight that they have moved to an employee-based system to fill that gap in care, adding that all healthcare providers at Corewell Health providing sedation or anesthesia services are held to the same high-quality privileging and safety standards, and they continuously monitor safety and quality, and the data shows their teams continue to deliver high-quality care. In Grand Rapids, Duncan McLean, News 8. Now, Corewell Health got back to us just before news time with a few clarifications on the story, emphasizing that this is only affecting hospitals here in West Michigan, not facilities system-wide. News 8 also looked into national numbers. Open positions for eligible medical school grads are up 19.8% in anesthesiology since 2021, but this year they were filled at a 99.9% rate. Only one position nationwide actually went unmatched. And anesthesiology remains in the top 2 for specialty choice among USMD seniors, MD grads, and DO grads. That said, there are 13 open physician anesthesia positions at Corewell Health right now. Sue?